once one starts going through the nuances of what it says, then I would leave it at that it's actually a very nuanced recommendation. So, because what they are saying is, if you had an exposure that could have led to infection, that you don't need to go for testing right away. So they say there are, now if you are an individual who is at risk for having poor outcomes, so that your healthcare provider still wants you to get tested, or your public health officials want you to get tested, then you should get a test, even if you're not exhibiting any symptoms. Always testing people who are not exhibiting symptoms has been a little bit, tricky, right? Because if you have an exposure today, or today you get called that you were exposed to someone with the virus, and that happened maybe 3 or 4 days ago, and you said, oh my gosh, I have to get tested, and you go get a test. Your test may come back negative today, but you're still within a window in which you could get infected. And so I am wondering if they were trying to get a little bit at that. Perhaps, that if somebody goes for a test while they are asymptomatic, could they be, in a way, be lulled into a false sense of security when they are still in a period where they can go on to develop either an asymptomatic infection or an asymptomatic infection?
People aren't getting tested, then you're not doing that contact tracing, right? Which is so important. Mm-hmm. And you're also not reporting what is actually going on in the community, because that's reportable data. I mean, we mm-hmm. can't report, there's no way to know possible cases, because those could be in the millions.
Yeah, and I think that's the other thing, right? That you also then have to think about. That's, you have, what we are losing with this change in guidance is potentially losing certain asymptomatic infections. And what we don't know is then how much spread are we actually going to lose? Because if you are, or how much spread is actually going to be generated from this, right? Because now if someone has an infection and you are exposed, but you don't know, then the responsible thing to do is actually to stay home. And none of this stay home if you're sick, it's stay home, period, And so, but I also go to the other caveat on that recommendation, because the recommendation does say that even if you are asymptomatic, but your public health, the public health guidance that you receive, public health officers in your community still recommend you get tested, then you should do it.
Do you have any idea what led to this decision change? I mean, what is there evidence that they're looking at? Is there data? Is there what could lead them, what we've been discussing in our newsroom is like, what gives? Why would you do this?
One thing that I don't know, one generous way of looking at this is, I don't know if they are trying to manage, or maybe manage is not the right word. I don't know if they are trying to anticipate even more shortages in testing as we enter the cold and flu season. So it's a way of trying to hone down, or making sure that that there are tests available for those ones who are sick. I don't know if they might receive some more information in terms of national availability of testing from all the manufacturers. So that's one thing